Hi, I'm Jenny Owens with the Health Data Ethics Podcast, and I'm here today with another interview guest. Dr. Mather, do you want to introduce yourself?
Yeah, hi. I'm Piyush Mathur. I'm an anesthesiologist and ICU physician at the Cleveland Clinic. I'm also the co-founder of BrainX and BrainX Community. So, I've been working in AI and healthcare space, trying to understand and apply AI to healthcare for some time now.
I am so glad that you made time to talk with me. I know this is not the first conversation we've had about, AI and medical innovation, and I'm sure it will not be the last, but it's nice to have you on the record to discuss.
Thank you. I'm
Um,
honored to be here.
yes. So initially, we first kind of connected on this topic when you were discussing some applications for artificial intelligence with CPT codes. Can you tell me a little bit more about that?
Yeah, so once these applications have been developed and deployed, of course, you want to use them and you want to get paid for them. So that's why where there is guidance and there is a pathway from AMA, that is the American Medical Association, and CMS to have payment codes or the billing codes, which we commonly call CPT codes, associated with them. So once these algorithms have been validated and been approved, they get approved through AMA and CMS for payment, and there are quite a few examples of that happening now.
So tell me a little bit more about the validation process. That's something that I always wonder about. When we talk about validating algorithms, talk to me about how that actually works.
Yeah, the initial validation occurs during the development phase, where there are test sets and there are validation sets that are there. And as you develop the algorithm, you test that and validate those algorithms. But then subsequently, you need to validate them externally, not just in your own patient population, but you want to validate those at amongst different patient populations at different hospitals in different settings. And that's where some of these trials or randomized controlled trials happen to validate these algorithms. And then, of course, there is a detailed FDA approval process for many of these algorithms too.
That's so interesting, and I cannot wait to dive more into the FDA regulations. Talk to me about if a health system were to put some of these algorithms in place, what would they see as far as their workflow? What could they expect to see change?
Yeah, so currently, most of the algorithms work as clinical decision support systems or
Mhm.
CDSS. And what you hope to see is seamless integration. And
Mhm.
most of these work very well as very well integrated decision support tools in your electronic health records or certain devices. So, what you would expect to see is clinicians looking at the output of these algorithms, either through their EHR or through the devices, and then they can interpret or analyze that and see how they want to use it.
Cool. This is so interesting. I am just thinking about all the ways in which all the algorithms that we interact with on a regular basis that are invisible to us, right? I'm thinking about
That's right.
monitors that are alerting, not just best practice alerts that pop up in Epic, but all sorts of things. I don't know. It's fascinating. There's a lot more AI currently in practice, I think, than any of us realize. Tell me a little bit more about BrainX. Tell me some of your thoughts about other uses for artificial intelligence in the healthcare setting.
Yeah, so BrainX was formed around 6 years ago. It was a group of us clinicians coming together with some machine learning experts and some administrative counterparts, trying to understand how AI can be applied to healthcare. So we started 6 7 years ago trying to understand this. And as we formed our team, one of the things we realized was that there was a bigger ask. There were a lot of other people asking similar questions, and ended up forming BrainX Community, which is a larger worldwide group of 4,000 plus members internationally, where we share a lot of scientific information and we foster collaboration. So BrainX is very focused on evaluating, on doing R&D and fostering collaboration for AI and healthcare, and we are available for consulting too.
Very cool. What is the most recent article or concept that's come up in this community that's got you most excited?
Yeah, I think the large language models, of course, are right now a very hot topic. That is something that we are also very focused on. And interestingly, when Transformers came about in 2018, that's when I finished my training in Transformers. and I've been using, and our team has been using Transformers since then. So when while a lot of world thinks about GPT as a new tool or new technique, we have actually been using Transformers and some of the generative technology for quite some time. Very familiar. Rather, that's been our focus area for some time. So we have that expertise, and we are very quickly evaluating how we can adopt some of these amazing tools to healthcare.
Yeah, there's a lot of opportunity. It's really cool. I know that we do not have a ton of time today, and I know that I would love to have you back to have many more conversations. Today, is there anything you want to tell me that I haven't already asked you?
Yeah, I think the opportunities are great. And that's why the few areas that BrainX is very focused on is general application of AI to healthcare. So a lot of us are surgeons, anesthesiologists, but we have a larger team which consists of cardiologists, critical care physicians, radiologists, and of course the AI experts who have completed their PhD in this. So we are very focused in general application of AI in healthcare, and not just one stream. There are many other companies or groups which are very focused on maybe image interpretation or maybe for some cardiology applications. We look at this as a great opportunity to apply in different sectors. So we are looking in general where all these opportunities are. And one large part that stands out for us is operational and financial.
Mhm.
How can we bring in operational and financial efficiencies into healthcare system, which a lot of clinicians desire? We worry about terms like burnout. We worry about terms like we are losing money. There is
Mhm.
difficulty with access. So how can we apply AI to make this seamless? And that's where we are very focused. The second part for BrainX is bringing education to clinicians and at the same time to the data scientists, because there is a gap over there and we're trying to bridge that gap. And that's our effort with BrainX community, where we provide a lot of free resources to everyone. The third part is to foster collaboration. So we have had a lot of collaborative work across the world with different institutions, different organizations. One of the important collaborations for us is being led by different members of BrainX, looking at evaluating these algorithms. How
Hmm.
good are these algorithms? And Dr. Maheshwari, for example, has worked on the pilot study on hypertension prediction index locally, and then
Mhm.
I have been blessed to be part of multiple groups across the world who have put out evaluation frameworks for these algorithms. So we are very focused on evaluating these algorithms and putting out these frameworks so that people understand how best to use them and whether they are applicable for what they want to use them for. And then lastly, big or small, there are needs where people don't understand these tools well. And that's why we have made ourselves available for consultation. Whether you're a startup that you are looking to understand whether you're going in the right direction, or whether you're a hospital that is looking to deploy a AI algorithm at your place and you want to understand whether that's the right algorithm to deploy, we are here to help.
That's wonderful. If I wanted to learn more about BrainX community, where can I find you?
Yeah, so we can go to brainxcommunity.com, as simple as that.
Perfect. Thank you so much, Dr. Mather. I really appreciate it.
Honored to be here. Thank you very much, Jenny.